Hey, everybody. So it's Friday, out your way. And this is our final segment for right now on what care partners could consider doing maybe differently, more in a different way, right after the identification. I think what you're looking at is a dementia. And so we've talked some about what we're thinking, but let me go ahead. I'm going to throw a slide up here, because we have covered some things. So I'll review sort of some of those things. Like, what do I think the essential prescriptions or recommendations are? And what we've covered so far is we think that asking for a return visit in about a week, or maybe less, but definitely not the same time to process. And there may be processing going on between times, but definitely giving some space and some cool down and some think through and some back and forths. Then a pharmacy consult, because, if there are any medications to be considered or involved, we want to sort of do a baseline on what's going on before we start jumping somewhere. Then a follow-up referral, we think, for support, education, connections. And these are for both the care partner, the person living with, and anybody else who we can sort of bring into the picture and is part of the picture would be a great idea. And then this next one, I think, gets skipped at this point frequently because people think they've already done it, which is both a screening and an assessment for IADLs, which is living in the community, my life, how's my life going, and bigger life picture. And then ADLs, which is how am I taking care of myself and where I am in my place. So looking at how's life going right now. So figuring that out, are there already areas where, yikes, or are things pretty smooth and working right now? It's just more of a cognitive fog and challenge, but it's not tearing things apart yet because frankly, I'd already done some modifying of my life. I've already made my life. We don't know for the person living with dementia what might be going on, but we need to, as a team, start looking at these things because the definition of a dementia is that it changes your ability to live life the way you've always lived it. It is changing your ability to live. So I added that one. So thinking about it as a disability, we talked some about that. It's not a death sentence right away. Life is a death sentence. But what we need to start thinking about is, okay, where is the person in their disability state in these different areas? So where are they still working fine? And where are they starting to have some question marks or difficulties or real disability? I'm not able to do it at all. And I don't know what to do or how to do it. Make it better. And as a care partner, I need to assess strengths as well as areas for possible change. And so if we looked at diabetes, this would be that point at which we're looking at what, Matthew? When we look at diabetes, what do we look at? Somebody's been diagnosed with diabetes. What do we immediately start thinking about?
Yeah, so they start setting up a care plan for that person on what they can start shifting in their life and support that they can get to be able to make those shifts to manage that diabetes. And so a dietitian and, the doctor visits to check the labs and the medications potentially to help. So there's so many pieces that start to fall into place to support that person once they get that.
Yeah. And so what's really important there, just like in dementia, is we got to establish where are they on all these fronts? Like how much exercise are they doing? What might be getting in their way for exercise routine? What are their eating patterns? What might be getting in the way for an eating pattern that is better to this thing, or what might have precipitated some of the diabetes? Or, so like the system's obviously in distress or you wouldn't be having diabetes. So we've got to figure this out, but it can't be a fight with the person, because that's not a healthy way to treat diabetes, especially if one of the reasons you might be experiencing diabetes is that you're a comfort eater. And so I make you more uncomfortable, and then it's going to make it harder for us to try to deal with this. And so that's, this idea of let's look at something we do already and let's see how we do that and do it well and do it poorly. And let's see, who benefits from that and how. And it turns out there might be some similarities here. So that puzzle, that care plan thing, what's really important to start thinking about all the pieces that we're going to need to put together for this care plan. Now that's after you've taken that week and you've gotten that support and that consult, so that now you're starting to regularize, oh, this is a new normal here. This is the new life plan. This is the new way we got it. This is going to require rethinking a little bit, because we got something going on here that is going to change things. So I think one of the parts that gets missed early on is the potential of either a mentoring peer or a group of peers, peer support. And we hear that a lot from our core team, that finding people who are similar but not exactly like me can be really, really helpful, because I'm now living with something, and it's helpful to have other people around me who are also living with this thing. Or it might be helpful to have at least one person who is a little further in their journey to be my mentor or my support. So that's number one. So that's set. Now, what does that mean for a care partner? Matthew, what would it mean if you were my care partner? Because we said first, you got to learn about how brains change and how brains, how much is, what's going on brain change wise. What might that mean if you were my care partner and I was the one living with dementia?
So, and with this piece of getting peer support, and I'm curious, Teepa, if then that piece would be, I'm going to need some support as well from somebody else who's also going through the same thing that I can communicate with, that I can connect with.
Yeah. So, so Matthew's probably going to need some support, either peer or mentor, because he's going to have to figure out what's the best way, in some cases, if he's my partner or my other person, how to bring up the idea of peer support to me. If I'm having a hard time getting data in, or who should bring that up? How should it come up? Because if I'm a real private person, this may feel like exposure. And so figuring out something as simple as, from a care partner perspective, how do you introduce the idea of somebody getting some support? And Matthew did it well by saying, I think I'm going to need some support. And that might be a technique that works. I'm going to ask you for a big favor. I'm going to go to a support system. And this is where Jerry Wiley is a great example of somebody who does joint support groups for the person who's living with and their partners. And they do it together because they found that that's a terrific way to learn about brains and how brains work. And they do it as a team rather than these isolated things. So, if we're partners, maybe we peer support. And then maybe there's times we talk to other people, isolate. But the second thing you saw me put up here, if you were paying attention, is technology support. And, so looking at how you could use technology, how I could use technology, and what kind of support for technology might be needed. But technology is coming more and more to the front as a way to help monitor things so that you're not getting too much in my business, that it doesn't feel like you're leaning over my shoulder all the time, but that I have you when I need you and you have time. So looking at technology, I think, is something that it's moving higher on my priority list, people's tech abilities and interests. Then I think this one is an underrated one. What are volunteer or purposeful engagement opportunities that now exist for this human being? And what part of my life do I have to volunteer and have purpose and value in doing something with somebody? So really looking at what am I going to feel good about, because it gives me a sense of value and purpose as a care partner. But what are opportunities out there for other people, including the person living with, to do that might give some value or purpose? So that idea of, boy, is that an important part of life? Let's not skip it. And then looking at, okay, so wonder what kind of physical activity engagement support I need, they need, we all need. How do we do more physical? Because we know physical has an impact. So now I know some areas classically that get left out or get told, but don't get well supported. And I think that's, again, it's like, this is what you should do versus let's see where your brain is, where your body is. Let's see where you are mental health wise, and let's see what we can do with that. And let's do something that sort of screens for where you are. And this is where, like something like even going to a Total Health Works free Wednesday session and being part of that and see what happens. Like, I want to try something. because those Wednesday sessions, people have diagnoses, don't have diagnoses, are curious, are just people who want to keep themselves fit. There's all kinds of possibilities. Retained use. What do I have that I still can do? So when you're my care partner, I need you to see what I still am able to do. And you will need to know what I'm okay with. And if it's episodic or if it's consistent. You're also really going to probably want to get a handle on, is that unique to me, or is that consistent with what I would see with that dementia? Which leads us to, I wonder whether you want to know a little bit more, at least, even if you're not going to get a further diagnosis. What are the symptoms? What are those symptoms that are getting in the way? So what parts of the brain are not working as well as they used to? And what are just, Teepa's never been good with left and right, trust me. So I doubt she's suddenly going to develop that skill. So, seeking wayfinding. So now we want to check out her wayfinding. Well, she's good at wayfinding. She just can't talk about it or describe it or turn on the right turn signals. So I wouldn't get freaked out when I say turn left up here and I go, no, left. And you're turning left, but I meant right. So, just saying. And then finally, I think one of the most skipped parts is let's talk about our sleep patterns and our activity cycles. I need to know my own. I need to be really aware of yours so that when things are starting to get rough, I know how much it is that I'm getting tired. This is not a good match. So, all right, Matthew. So there's my short laundry list. There's more, but I really thought we should stop right about here because I'm filling the bucket. That's 6, probably more than most people want to hear about.
Yeah, it's a lot of information and definitely a lot of things to really process and digest all of these different pieces. Definitely, Teepa, I think for me, the biggest piece though is that making sure that we start looking at getting those support, the support in the beginning, how that could really help go through a lot of these, because so many folks have learned a lot of these parts the hard way, and some maybe the easy way, but they figured out through, those moments of, man, I wish I would have known this before. And so having those people around who've been through this journey, who've had the experience, how that could really help as we're starting in this new direction, this new journey with somebody who we love or we care about or caring for. So, our roller coaster, Lewy Body Roller Coaster podcast is another, our group that does that. I mean, that, the friends of ours who are doing these things, we support them in that, because honestly, those folks are living the life. And, that idea that, Linda and Curry, when they got together, there was that immediate bond. But when we meet people that but becoming smart, not just finding emotional connections, but becoming more skillful is really what we advocate for. And the way to do that is be around other skillful people and people who've failed and tried again and learned something. And so I think Care Partners, what we're saying is it's quite a journey. But part of it is what you make of it. And you're with someone, and you probably are going to need breaks and get off the train every now and then, because your brain isn't the one that has the dementia, but it sure starts to feel like it's impacting your life. And it is important for you to recognize when you need a break, because you're part of the solution or part of the problem. So going forward, take care with care. Matthew, anything else you want to add in? And we have done recordings like what Teepa mentioned, the Lewy Body Roller Coaster folks and many other groups out there. And so, please look back at a lot of the stuff that we have to find some of those areas of support, or reach out to us at info@teepasnow.com. and ask us, and we would be more than happy to share with you what we know and help to create those connections with folks who can give you some support.
All right, everybody. We'll see you again next time. Take care.
Bye, everybody.